reporter, and I'm going to be discussing the biopsychosocial approach for healthcare communication class 126. First of all, I want to start off by talking about an experience I had recently when I went to a rheumatologist for follow-up testing that was positive for some joint conditions. They were concerning for me. The doctor appeared to only be concerned with my physical condition. I had a lot of fears surrounding physical concerns, but more concerning for me was social and psychological issues with what was happening to my body. According to the text Communicating by Health by Dupree 2010, I was viewing my situation through the voice of the life world. Now just think about it for a moment. Have you ever had an experience where a healthcare provider appeared to be more concerned with physical diagnosis rather than with you? How did that make you feel? I know for me, I didn't feel like I was heard. I personally have been in healthcare for over 20 years. I began as a CNA, transitioned to an LPN, and am currently an RN in practice. I've worked in various types of settings, from physician's office to home health and hospitals. In the article called Understanding the Biopsychosocial Approach by Gilbert, 2002, he speaks of the often reductionist biomedical perspective. I often see this in practice, more so than the biopsychosocial method. The biopsychosocial approach proves to promote health and wellness for patients by viewing them in many different aspects. In order to understand this approach, we will be discussing a little history behind it. I'm going to attempt to define it and give some tips to put it into practice. For our early history, Gilbert and Dupree discuss how Hippocrates promoted health as harmony. He looked at factors that included diet, contrast with nature, relationships, and physical well-being. According to the Medical Surgical Nursing by Lewis, Dirksen, Heitkemper, Buckner, and Kammer 2001, Florence Nightingale, a well-known nursing pioneer, suggested and implemented improvements for patient-centered care by encouraging statistical data to record evidence-based improvement. She found patients improved with good food, clean conditions, social support, and biological considerations. Later in history, we get to Adolf Meyer. He was a psychiatrist who reframed how mental health diseases are viewed by using the biopsychosocial approach, according to Gilbert 2002. In another online article called The Biopsychosocial Model 25 years later, Meyer insisted that patients could best be understood and treated through viewing mind-body reactions. Another pioneer most closely identified with this approach, in fact more so, is George Engel, and he's pictured here. In the same article previously mentioned, he was known for discussing social, psychological, and biological factors surrounding heart disease, a physical ailment. For example, in the article by Gilbert 2002, some psychological factors he included were coping and stress causes. Social factors included poverty, smoking, lack of support systems, or job-related issues. Finally, physical factors of genetics, diet, and lack of exercise. Notice that the first two columns, or the first two things we discussed, have more features to them, more so than just the physical. Next, we're going to attempt to define the biopsychosocial method. This method considers physical or biological, thoughts, ideas, perceptions, or psychological, and social concerns according to Dupree 2010. Here we have three bubbles, biological, psychological, and social. They each overlap to one center. It's also not strictly physical or reductionist in view, but considers thoroughness and personal concerns. For this, I have two examples. Gilbert's 2002 article states that evidence has shown stress will increase the heart rate and blood pressure. Add genetics, poor diet, and any or all of these will increase the risk of stroke, heart attack, or high blood pressure. Another example I found in some Cliff Notes online on the subject talked about if a person has depression. This can be from several causes and can cause other problems as well. For example, Messages of worthlessness, shame, fear of rejection, inadequate communication, poor social skills acquired from overtly critical parents could be a social factor cause. In trying harder to be accepted by others, they create more rejection, causing more depression, perhaps a lack of self-care in regards to hygiene. This creates, in turn, more isolation, rejection, and still more depression and lack of self-care. Finally, we'll discuss some ways to practice the biopsychosocial method. Dupree 2010 describes that this style does not require any more time than a biomedical approach. In fact, evidence states to the contrary, as this method works best when teams of healthcare providers work together. Broad ranges of concerns can be addressed quicker and altogether, such as personal resources, nutrition, medical, well-being, community, and family support. In practice, it's best to start by initiating trust and empowering patients. Here you see the doctor shaking the patient's hand. That was actually a suggestion in the book. This can also be done by increasing patient knowledge of the disease and treatment choices, by giving various information tailored to that particular person's learning style, because everybody learns differently. Also following up with patients in regards to the effectiveness of treatment and changes needed to make sure that they're being compliant with treatment and to answer any questions they might have. More importantly to remember is to patient-centered relationships, using self-awareness when diagnosing and treating, and getting a thorough patient history, remembering the patient looks through the voice of the life world in regards to their situation. Finally, according to Vera Crowless in mental health nursing, it's important to focus on the main psychological, social, and biological concerns. In conclusion, we know that this method has been used for many years, centuries even, to help promote health and wellness. We also know it doesn't take much time to do. This approach addresses many facets of a person that can affect their health, not just physical. It's listed in this picture here. Again, this biopsychosocial approach proves to promote health and wellness for patients by viewing them in many different aspects. It is a responsibility that as healthcare providers, we learn and apply this model into practice. Then the people we care for will achieve overall health and wellness for an improved way of life.